wait. Thank you so much, Dr. Vinita Dubey, for joining us once again for our weekly Q&A about all things COVID-19.
Thanks for having me. Yeah, we got through it. Yeah, we're live.
Yes, we're live. Okay. So if you're new to this Q&A, my name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. The way it works is we have been collecting your questions all this past week, and we will present them to the doctor. She's never seen them before. This is the first time. If you haven't had a chance to submit your questions, you can still do so under this live broadcast, and we'll try to get to them in this short half-hour period that we have with the doctor. So I'm going to get started with the submitted questions. Doctor, are you ready to go?
Yeah, let's go.
Okay, excellent. Let's do this. So let's start with Nancy's question. Nancy asks, with all the conflicting messaging from NACI, will those of us who received the first dose of AstraZeneca and who are happy to receive the second dose actually be able to get the second dose? Or will the province consider using unused AstraZeneca doses as second shots if they have not expired?
Yeah, so these are good questions. And actually, the big thing about which dose you get for your second dose right now seems to be based on supply. NACI actually has a recommendation right now that it is whatever you had for your first dose, that you complete your second dose with that same vaccine. If it's unknown what your first dose was or it's unavailable, then considerations can be made for an alternate vaccine, but staying within the family, like a viral vector versus a messenger RNA vaccine. In terms of right now, as I understand it, there are no current plans in the near week or two for getting more AstraZeneca. But, you know, when second doses are due, hopefully we will have some available. What we do with the current doses of AstraZeneca, I haven't heard. Those are provincial decisions, whether they can start doing second doses with those. So I think more to come on that. There will be more guidance from NACI as well, too, though, specifically about, well, what if the vaccine is not available? What if people decide that they want a different vaccine, for example? So there will be more guidance coming out on that, both from NACI and also from the provincial government.
Okay, lovely. Excuse me. And then Pamela asks, again, connected to the latest information about AstraZeneca. She says, what is your take on the news that came out from NACI on the AstraZeneca vaccine? For those of us who have taken it, how do you ease our minds on it still being the right choice that we took it?
You know what? It is the right choice. I mean, I think what we have to recognize is COVID is a moving target. And right now, where we sit right now in Canada, we have a plentiful supply of messenger RNA vaccine coming in. We don't have any sightline for additional AstraZeneca. And so that's part of the discussion for right now. But in March and early April, when we had AstraZeneca vaccine, we were into our third wave. That was the vaccine that we had. I think it's also important to know that we didn't know a lot about these serious blood clots. And as we know more, the recommendations have to change. We have to take the science into account. Originally, when we heard about them, it sounded like in the UK, the risk was 1 in a million. Now we know that that risk is much lower. It's 1 in 50,000 to 1 in 100,000. And so that informed consent piece, again, for the individual getting another dose, it's up to the individual to be able to decide based on the current evidence. We don't actually know with that second dose of AstraZeneca whether that complication, that severe blood clots, are more common or even less common after the second dose. We know in general with the AstraZeneca vaccine, the first dose tends to give you more of the side effects and the second dose actually less. So, so again, the recommendations have to change based on the current situation where we're at. I know that can be difficult sometimes from a public perspective. It feels like science is flip-flopping. It's actually updating the recommendations based on the current available evidence. And some of that is evidence about the vaccine, about the side effects, and some of that is also based on the supply.
Right. Right, absolutely. And then more about AstraZeneca and Johnson & Johnson. Mike asks, we have heard much about the various types of rare blood clots from AstraZeneca and Johnson & Johnson. Oh, this is actually about Pfizer. Why have we not heard about the documented reports of blood clots in the heart muscle in males under 30 years of age after receiving the Pfizer vaccine? I'm not clear if there are any reports of that.
Okay, so good question. So I think what what we're here, what the question is about, well, what are the safety signals for Pfizer? And we know that this this vaccine-induced immune thrombocytopenic purpura, that's a lot to say. That the severe blood clots for AstraZeneca and Johnson & Johnson, that signal, that safety signal, has not shown up for the Pfizer or the Moderna vaccine. But what is something that's being investigated is myocarditis, which is an inflammation of the heart muscle. It seems to be young, healthy males or young males that have gotten their second dose. That is being investigated right now, as I understand it, in Israel and also in the US, but it's under investigation. And so if you haven't heard more about it, it's because it's still under investigation. Again, the procedures that we have in place to watch for side effects after vaccination, they are working, and they are certainly something that is a signal and something that we want to be able to watch for.
Right, absolutely. Sorry, doctor, looks like we're having a few technical issues today.
Yeah, no problem.
We've lost your video.
Okay, I'll see what I can do there.
Thank you to everyone tuning in. Today's been a technical issue kind of day.
Okay, I'm back. I don't know if you are.
Yes, yes.
Yeah, okay.
Excellent. All right, so let's move on to our next question here. Wondering asks, I had my first dose of AstraZeneca vaccine on March 13th. I will not take a second dose of AstraZeneca. How long should I wait before I start the vaccination process over with Pfizer or Moderna?
Okay, so a couple of points here. One is, I do want to say, okay, you had your vaccine March 13th. The side effects for this, blood clots or whatever, are up to about a month, 28 days. And so I just want to reassure you that if you had it then, you're out of the window for getting that serious blood clot. So that's the first thing I want to say. The second thing is, if you decide, based on what's now currently known about the AstraZeneca vaccine, that you don't want it for your second dose, the National Advisory Committee on Immunization will give more guidance on this. You know, do you need to then restart a series with a different vaccine? Is one additional dose of another vaccine enough to complete the series? Those are that's the kind of advice that we're expecting will be coming shortly.
Okay. And then we've got a live question coming in from Debbie on Facebook. She asks, can you take the shots if you have a low immune system?
Absolutely, yes. So the shots are safe if you have a low immune system, a weakened immune system. If you're even on drugs like chemotherapy drugs or transplant drugs that weaken your immune system, the vaccines are safe in those situations. What we just know, though, is that because you have a weakened immune system, you might not develop the best immune response to the vaccine, but you will still get some protection.
Okay. And then Sandy and Carolyn actually have a very similar question about Botox injections. Can the COVID vaccine interfere with Botox injections for a person who has dystonia?
Sorry, I lost you there for a second. Can it increase, can the Botox, can you repeat that?
Absolutely. We've also lost your video again, unfortunately.
Yeah, sorry.
It's one of those days. But I'll ask the question again. So can the COVID vaccine interfere with Botox injections for a person who has dystonia?
Okay, so good question. So what I would suggest is if you're taking a specific medication like Botox, what you want to do is connect with your doctor to find out, should there be some timing from when you get your vaccine to when you get your next medication dose? And maybe it's better that you get your vaccine and wait a week or two before you get your next injection. That's the kind of information that your doctor can help you with. There's no risk. There's no, it's not unsafe for you to do it, but what you want to make sure is that you get the best immune response when you're vaccinated.
Right, okay. And then NFL asks, should you not be tested for COVID before getting the vaccine?
No, that's not necessary. So you can, even if you have a COVID infection that you're not aware of, you can actually still be vaccinated. The vaccine is not harmful in people who currently have COVID. And we do recommend, though, if you know you have COVID and you're contagious, please do stay home. We don't want you at the clinic to avoid any possibility of spreading COVID. We do have measures in place to make sure that we won't spread COVID, though, at the clinic, but there's no need to get tested before you're vaccinated.
Right, okay. Sorry, doctor, technical issues continue.
I know.
Video again. There we go. Okay. Okay. Let's try one more. Let's try to continue here. Okay. So AJ asks, after testing positive for COVID-19, how long should a recovered person wait before accessing the vaccine?
As long as you're no longer contagious, then you can access the vaccine. So usually in most people, that's 10 days from when your symptoms started.
Okay. And then, all right. David asks, I received my Pfizer COVID-19 vaccine on Wednesday, April 28th. The next day I started feeling really bad and I lost taste and smell. I'm still not fully recovered as of today. How did the vaccine work to make me sick?
So I would recommend that you actually get tested for COVID. We know that the COVID vaccine takes at least 2 weeks before it can provide you protection. And we know that there have been people who were exposed before they were vaccinated and could have got COVID. And we know that one of the symptoms, if you have a loss of taste or smell, that could be COVID. And so I definitely recommend that you get tested. If you test positive, the vaccine can't make you test positive. So it means that you unfortunately caught COVID. So that's what my recommendation would be. In fact, today, some of my colleagues in Public Health Ontario have put out a really great analysis that shows that the risk of getting COVID if you're vaccinated is extremely, extremely low. The highest risk of people who get COVID when they're vaccinated is in the first 2 weeks, and we know that that's because the vaccine doesn't work in that time frame. And beyond that, it's a very, very low.
Okay, and then we have a live question coming in from Greg. What is the point of getting the vaccine if you need to get it again and again? And this is actually connected to a few questions that we have submitted over the past week, whether you need to get the vaccine every year, how long does the effects of the vaccine last?
Okay, well, let's talk about where we are at right now. And right now, I can say in the city of Toronto, our rates of COVID are still very high, averaging more than 1,000 new cases a day. And that's why we need to get vaccinated right now, because we need to use vaccine as another tool to help us drive down those rates of infection. The second dose will then give us that broader, longer-term protection. And in the future, if there's a new variant out there, there may be a booster dose that may be required, but that's not a guarantee. And so the reason to get vaccinated now is because right now the risk of getting COVID, of catching COVID, of ending up in hospital with COVID is quite severe.
Right, absolutely. And then, okay, let's go to Elizabeth's question. Elizabeth asks, since my parents have their first shot of the vaccine and I got my first shot of the vaccine, can we visit each other?
Right now, we're at stay-at-home orders in Ontario, and we've done a very good job as a province of getting the cases down. We've bended the curve. It looks like we're on our downward trend. That going down can sometimes be much slower than going up, and that's why we all have to do whatever we can, stay at home as much as possible. Avoid indoor gatherings. Don't visit with people who you don't live with, especially indoors, because we need to get those numbers down right now.
Absolutely. And then there's another question from Brenda on Facebook coming in live here. Why is it taking so long to get vaccines?
So the vaccine supply is increasing. As of this week, it's gone up to over 750,000 doses in Ontario this week. It's going to be high like that for the rest of the month, and in June it's expected to go up even more. That was just the Pfizer vaccine, and then we're also getting some Moderna and maybe some of the other vaccines as well too. So it's the federal government that procures the vaccine. They're the ones that had the contracts to get the vaccine, and that has been one of our biggest challenges in Canada is vaccine supply. But the supply is improving, which is really, really great news.
Right, absolutely. And then we've got a few more questions coming in live from Facebook here. Ida asks, what if you have high blood pressure? I'm assuming in connection to vaccines.
Get vaccinated. Yes. High blood pressure is actually one of those conditions that can put you at higher risk for getting severe COVID. And the high blood pressure, you don't have to worry about it being impacted negatively by the vaccine.
Right, absolutely. And then Vala asks, how many people in Toronto have been vaccinated?
Last time I checked, it was more than 1.2 million doses have been given in Toronto. Some people who are getting vaccinated in Toronto don't necessarily live in Toronto, but 40% of Toronto residents who are eligible, like adults, have been vaccinated, which is great news.
Excellent. And then I don't know if this is a question you can answer, doctor, but I'm going to ask it. Marvin asks, coming in live here, why are Florida's COVID rates continuously dropping and they have no restrictions at all?
Yeah, so Florida is actually vaccinating many people, actually, and Florida has opened their vaccination up to everyone. We actually know that some of our professional sports teams in Toronto who are playing down in Florida have been eligible and have actually been vaccinated in Florida. So I think part of what's working there is the vaccinations for sure.
And they have supply. They have supply of vaccines for people, for enough people to get vaccinated for the rates to drop, right?
That's right, and to get their second dose as well. And I think it's also important to look at the variants. And we know part of what's going on in Ontario is because we have these new variants that are spreading. We have the UK variant. I'm not sure right now if Florida actually has variants. And I think the timing of the variants came in Ontario before we even had enough people, even hardly any people vaccinated. We really just had our long-term care homes vaccinated before the variants came. We've seen that the long-term care homes have done very well, considering we're in the midst of our worst third wave. And so I think that that's the other piece to wonder is which COVID is spreading in Florida.
Right, absolutely. And then again, we get this question a lot, and I'll ask it. Vanda asks, why did the FDA not approve these vaccine injections?
Why they did actually. The FDA, so the U.S. has a process for approving vaccines. The U.S. has not approved the AstraZeneca vaccine. Maybe the question is around that. And as I understand it, they were waiting for the trial results from the AstraZeneca trials that were done in the U.S. before they would consider that. But the U.S. has certainly, the FDA has certainly approved the other three vaccines that are used there, the Pfizer, the Moderna, and the Johnson & Johnson.
Right, right. Okay, and let's go back to our submitted questions here. Beth asks, could a 21-year-old who does not live in a hotspot but will be working at a camp in a hotspot be eligible to get a vaccine, and how should they go about inquiring about this?
Okay, so actually by the week of May the 24th, 18 plus, regardless of where you live, you will be eligible to book a vaccination. I imagine that you're going to be working in a camp later on. If you are currently working as an essential worker, meet the qualifications for cannot work from home, then you will be eligible, some as early as tomorrow and some next week. But I believe camps are not open right now. So this is something that by the week of May the 24th, you will be eligible and you can book then.
Okay, excellent. And then we've had these questions about medication and AstraZeneca. So Marlena asks, my father takes aspirin daily after having a heart attack. Can he take the aspirin before he's vaccinated?
Yes, so you actually can take, even if you're on blood thinners, even the stronger blood thinners than aspirin, you can still be vaccinated. Aspirin is a type of blood thinner, and so it just means if you get vaccinated, when the needle goes in your arm, that you might just want to put a bit more pressure or, after the vaccine, just to make sure you don't get bruising.
Right. And then another question, can we take painkillers after getting the vaccine? This one comes from Naveed, I'm assuming because your arm gets quite sore after the vaccine.
Yeah, you certainly can take over-the-counter medications after you're vaccinated to treat those symptoms. We don't recommend that you pre-treat, but if after you're vaccinated and then your arm is very sore, absolutely you can take those medications to help ease those symptoms. Yes.
Okay, wonderful. And then Rose asks, is the second dose of the vaccine exactly the same as the first dose, or is it different? Is it more of a booster?
It's the identical dose. So there have been no changes. The Pfizer that was given in January when I got my shot as an emergency doctor, it's the same Pfizer that's being given now. It has not been modified. There's no special first dose, second dose, for example, for any of the vaccines.
Okay. And then we've got a few more minutes. So Richie asks, and this is something a lot of people have been asking, why must we social distance if we are vaccinated?
Right now, the rates of COVID in our community are very high. And so the vaccines work very well. They are not 100%. And when the rates of COVID are so high, we want to make sure that even if we're vaccinated, we don't catch COVID, we don't spread COVID. And so that's the reason right now. As soon as we get our rates down further, we have more people vaccinated with one dose and with two doses, well, then we can ease up on some of those things. But until then, right now, the most important goal is to get people vaccinated and to drive down those numbers.
Right. And Doctor, we just talked about it, but since Tina is asking live, we'll take it. Is Advil safe for pain after the vaccine?
So ibuprofen, which is the active ingredient in Advil and other medications, is as long as you're able to take it, it's safe for you. Yes, that is not going to interfere with your immune response.
Okay. And then, okay. Susan asks, can I get vaccinated? I have had GBS.
Yes, so it's very clear that having had Guillain-Barré syndrome, that's GPS, is not a contraindication for getting vaccinated. In fact, getting vaccinated will help you prevent from getting COVID, and that will be really important for you.
Absolutely. This is a similar connected question Fanny and Hilda have. What is the percentage of those getting vaccinated that still contract COVID, and how many COVID deaths have there been of vaccinated people?
Okay, so there was a recent report that was just published today that showed this, and the rate of getting COVID if you're vaccinated is very low, less than 1%, much less than 1%. And I'd have to look back to the report to see whether there were deaths associated among those who were vaccinated who got COVID. But again, those who are vaccinated, you can get COVID in those first 2 weeks when you're vaccinated, and that's because the vaccine does not provide you protection then. But after those 2 weeks, a dramatic decrease in people who are vaccinated and get COVID. And so I can certainly look those up and share the results next week.
Absolutely. Thank you, Doctor. And then Victoria asks, do you have to get a second dose, or will you be safe with the one dose of the vaccine?
Definitely recommend that you get a second dose. The second dose acts like a booster dose. We know that the one dose provides good protection, but we know when we have a 2-dose series, that second dose can often boost the dose. The other thing is, to get kind of really technical here, that first dose gives you a B cell response. Those are your antibodies. That second dose can actually boost a different part of your immune system, the T cells. And that's another reason why it's important to get that second dose.
Okay. And let's see. So this is an interesting question that we've been that you mentioned earlier, but let's ask this question. Linda asks, how long after people received the AstraZeneca shot did the blood clots appear?
So it's between 4 to 28 days. That's when the symptoms can start following the AstraZeneca vaccine.
Okay, and a related question there, what other side effects can you get from AstraZeneca besides the blood clots?
So you can, with all of the vaccines, you can get a fever, a headache, not feeling well, chills. That can be actually more common in the AstraZeneca compared to the other vaccines, about 10 to 20% of people. Those symptoms tend to last for 1 to 3 days. The symptoms that you want to watch for from day 4 to day 28 are those symptoms of the blood clots. So trouble breathing, chest pain, swelling of your legs, a tummy pain that doesn't go away, a severe headache, bruising or spotting. Those are the kinds of symptoms to watch for.
Okay. And then Penny asks, does the vaccine make you extremely tired?
So fatigue is one of the symptoms in 10 to 20% of people who get following the vaccination. So yes, you can get fatigue following the vaccination. Again, that tends to subside by day 3.
Okay, and we just have 1 minute left here, so we're going to quickly squeeze these in. Wings and Daniel have a similar question. How effective are the vaccines against the double mutant variant that was first discovered in India?
So we don't really have a good answer to that right now. It'll depend on testing. Some of the testing for variants is done in the lab. Some of it is based on real world examples of the use of the vaccine. So I don't have a good answer on that. What I can say, though, is sometimes if the vaccine doesn't provide the best protection against the variant, sometimes it can provide cross protection. So just enough to keep you out of hospital or for getting very sick. But I'm sure there's scientists who are looking at this. And so hopefully, as they do, we will have more information on that.
Absolutely. And that brings us to 1 o'clock. Doctor, thank you so much for bearing with all the technical issues today. Thank you to everybody that tuned in and stuck with us through it. We will have the doctor back next week to answer more questions. So please continue submitting on our website. And as I said, we'll take live ones as they come in as well next week. Thanks so much, doctor.
Bye.
Bye-bye.